sharing my story, me sharing information of what's helped me. Some of it will be very personal because I don't mind sharing with you guys some of a thumbnail sketch of the abuse I've been through so you understand. Well, at least feel that if you've also been through abuse and you relate to that being a cause or a contributing factor of your central pain syndrome, understand you're not alone. So that's the main purpose of this group, honestly, is for us to um, all come together, realize we're not alone. And there have been many advancements in the last few years that have been made towards, finding solutions for central pain syndrome through amazing Dr. Forrest Tennant, through Dr. Carolyn McMankin, through what a good boy, through a variety of medical professionals that we've connected with through the Central Pain Syndrome Foundation that we have discovered different modalities ourselves. There's been a lot of things brewing and moving, and I think that COVID threw a monkey wrench in everyone's plans for everything, and we've all since been coping best we can. Um, and so, you know, COVID was a very different year for me, or 2020 was a very different year for me because that was the year I actually like broke free from my family and started doing everything on my own. But while doing that while having CPS and having just gone through a massive spinal um, collapse as a result of abrupt stopping of HCG from medical mistreatment and mishandling, um, was a very difficult thing for me. So my journey the last 4 years have just been rebuilding literally my life from scratch. And for a lot of other people, it's been, you know, a lot of patients here, I'm sure it's been like trying to, you know, not go backwards in treatment while the whole world is shutting down. I know there's people in this group. I could go on and on about stuff like this because I'm just an empath, but I know there's people in this group who have CPS because they got COVID, who have CPS because they got the COVID vaccine, and I've let people in who've had a baby and they got CPS from giving natural childbirth. They got CPS from an epidural or a C-section or like from trauma of being born. I'm telling you, you can get CPS. It's like I feel like you can, and it's not true, but I feel like you can sneeze and get central pain syndrome. I mean, it's just um, kind of kind of crazy. For myself, so again, going back to my story, who I am. So I was, to my knowledge, the source and cause of my CPS um, was when I was 16 and I had a horse accident. I fell off a horse and then he tried to avoid stepping on me, but ended up like on an upswing of his hoof, nicking my lower right parietal lobe behind and below the helmet. Um, and so it like kind of jostled my brain to the degree I stood up, everything went bright yellow. Um, then I was able to make my way with my horse over to my instructor. She was like, "Do you want to do you want to sit down for a minute? Are you okay?" I said, "No, I'm fine," because I had a very specific background in athletic sport for my entire life leading up to 16. So I was conditioned from a young age through gymnastics and again, like competitive sport, um, tennis and dancing. It was like, if you're not feeling the burn, if you're not in pain, there's no gain, blah, blah, blah. So I was already in the, habit of like downplaying my own pain, not not being aware that it was not normal. So I was like, "Oh, I'm fine, I'm fine." So I finally felt some wave of something come over me, and was just like, "Yeah, I think you should take him. I'm gonna go sit on the fence." By the time I got to the fence, I had gone unconscious, bounced off of the fence, like walking into it, and then fallen on the ground and was unconscious for 2 to 3 minutes. Um, so I didn't ever know that this basic phenomenon of hitting your head hard enough to black out, and blacking out is enough to cause central pain or central pain syndrome. But this was 2009 April, like the same time, same month, in fact, and I think in the same cluster of days that Scott had his cause of CPS experience. And so, what's crazy is that then a couple of months later, I was in Brazil and I was stung by a poisonous caterpillar and I attained the swine flu. Um, and so, all of those mega shocks to my central nervous system seemed to just like send my body into cascades of residual effects. But it took me literally years to accept the pain, to accept that it wasn't normal, to realize what had happened, to go back in the recesses of my memory and figure out that the brain injury could be the cause, that the concussion could be the cause, because it was every injury I had attained after the brain injury, which were some seriously crazy injuries as just being an athletic person and doing daredevil things. Um, so a lot of those injuries that I attained after, well, all of them after the brain injury, not before the brain injury because I had some from there, but after, were what lingered in my system, played on a phantom loop, and would not resolve. So that's how I figured out through watching Forrest Tennant's video about. If you've Googled, if you've YouTube Dr. Forrest Tennant, it's one of those main videos that comes up. It's like a 45-minute video of him talking about the hormone protocol. This was it's a little bit dated now, but in terms of, you know, I discovered that in 2016. Um, so I found this group just like any of you would have found the group, searching on Facebook. Once I had a doctor telling me, you know, like that central pain might be something to explore, I was looking into, you know, just any information I could find and discovered this group back when I don't even remember how many people we had in the group at the time. I just know I started asking questions here, just like you guys, I'm sure, feel um, to do. So I was just like, there was a doctor I was seeing at the time who um, was suggesting this therapy called prolotherapy, which still terrifies me to this day, the thought of it. It might help some CPS patients. I think it would be a very aggravating process because it's needles to the bone, introducing inflammation into the area that then the body is supposed to resolve, and including resolving any unresolved inflammation. That sounded terrifying to me. It sounded invasive. I was unsure. So I came asking, you know, came to the group asking about that and any other therapy that was suggested or thought of at the time. So it has been, I am now 32. It has been I think a couple months ago, maybe I realized, or when Scott posted his April, you know, story, that it was 16 years ago, I realized, oh my gosh, it's now every day thenceforth that I'm living is more of my life that I've lived with CPS than without, which is kind of crazy to think about. So this is just know that I'm someone who's been living with and learning how to figure out, cope, deal with all the different parts and pieces of how central pain syndrome has come into and affected my life for the last 16 years. So I'm not new to the condition. I'm not new to learning how to cope with it. The doctors, the, you know, hope, the research, the trial and error, the emotions, the devastation. There's just so much, excuse me, involved in all of that, of course. But what I wanted to bring to you guys today specifically was a bit of hope, honestly, that one, I'm actually having this monologue, but I'm able to sit here and cognate through this conversation. Um, right now, I'm in probably like about a level 5 out of 10 pain. Um, many days, and with the proper management, my pain gets down to around a 2, and will stay there for several hours a day. It does go up still to around a 5. I'm in more pain now than I typically am, but that's also because I haven't moved my body today. Um, and I haven't had a shower yet. There's a lot of things with heat and water and just movement and food. And the last couple of weeks, actually the whole last month, has been extremely stressful for me. So I think just the stress I'm in has contributed. So these are all obviously still factors that no matter how much treatment you do or reduction of pain you have from treatments that help or aid in the process of healing, we're still human beings. We're still going to be experiencing daily stressors, emotions, and need to manage our movement, and that's going to affect our pain as well. So those are the main things affecting it right now. And so you know, I've just had such a huge, massive, insanely mind blowing reduction of pain from a few of the modalities I'm going to mention that I can't not share. And I think I went back when I did the live I think it was 2019 that I did the last live. I did share a lot of so I shared a lot of information about frequency specific microcurrent and the hormone protocol because those were the 2/3 main things I was doing. I think I also shared a lot about um, use, just like management stuff, like use of water, use of supplements, use of which medicines I was taking. Big difference between medicine and medication. So the medicine I was taking, because I still don't take particular medication. I'm not sure which category trazodone falls under. Um, but anyways, I'm gonna get to like some succinct information here, since this is a whole lot of forward and introduction. So okay, so the I think only other relevant piece about my background, just briefly here, is that um, my father is a pediatrician, and he was the one who saw me right after the concussion, and he practically downplayed, overlooked the whole incident for years. And um, my perspective is that he was coming from dealing with histrionic, very understandably sleep deprived and emotional women who, with babies, who had every kind of question, thought any little thing was a concern. And I get it, because got a puppy now, and he has his own health challenge. So when he coughs funny, or, you know, I worry, there's different things I worry about for him. And I'm calling the vet more often now. Like, I don't even know if I should be calling you. But when you have either it's your first or it's a health challenge, I get that. But there is like a point two or point whatever 2%. I don't know the percentage. Again, I'm not a doctor, but some percentage of concussions do result in post concussive syndrome and issues years later, and it should not have been overlooked like that. It should have been investigated further. Um, a lot of the conversations with healthcare professionals I've been having lately are like, yeah, but a head injury is a head injury, and I don't care if it's a MTBI, mild traumatic brain injury, that's still traumatic. If you didn't, go into a coma, that can still be considered a TBI. There's just a lot of information coming to me now and later about how that being overlooked delayed the whole process and has resulted in like a lot of this pain being dragged out into years that it shouldn't have been and didn't need to be. I helped someone through our group in the last 2 years who had an injury within a year of, or within a 2 year window of the injury happening, start to use the hormone protocol. And to my knowledge, they're functioning and in massive reduction of pain as a result. Um, and I believe a huge part of their success has been getting ahead of the pain, like before it really has a chance to set in. But I'm not saying that if you've been in pain for like 16 years, like I have, that it's not touchable or changeable. Um, so I can see that somebody like hit the heart button, but I just don't see any comments. So I want to make sure that if there's anyone here trying to post comments, that I'm not missing it for technical reasons, real quick. But you know, you don't. That doesn't mean you have to comment if you're here. I just want to make sure that if there's people here, I'm not missing things. So and you can't. Sorry, you can't really like text or call me though because I'm using my phone as the camera. So it'd have to be either Facebook message me or put it in the comments. So so that's a huge. I think that's a vital piece of my story is the brain injury being overlooked um, and downplayed as well. And the other piece is that my profession is to work with misbehaving dogs. So I own my own company and I run completely my own company by myself. I do work with clients all across Central Florida and I drive into their homes and do private in home training for them. So that is what I do professionally. That is what I physically am capable of now doing. And the measure of, you have to understand where I've been and what I've been through, because that might or might not sound impressive, and I don't mean to say it to be impressive, but just to understand that is what that's where my focused effort is now. So I'm not um, able to be the go-to answer person for all of these little facets and details. So I'm going to give you the overview of information, tell you where to go to find more, and kind of have to leave it at that. And then I'll answer and help as I can. But just please know this, like, I don't have, because I work for myself full time and I'm very busy with what I do. I really like don't have that much time to also, as much as I want to. I don't have as much time to help everybody with all the details. However, I can point you to resources, I can guide and direct, and I can answer as I can. So please just be patient with me. Um, but I also say that my profession and my background, just so you know, like that's what I was doing, and that's what I had to stop doing in 2016 to go get treatment and figure things out. And then in 2022, picked up work again and have been for 2 years now, just absolutely physically capable of um, walking with clients, working with even strong, aggressive dogs, um, biking with my dog and other people's dogs, teaching them to do so. I drive all over, like I said, all over Central Florida. Many days I'm driving 2 to 4 hours. I take my boy with me a lot. So I'm in and out of places. Like the life I live now is so different than how it was when I was researching these hormones, literally bedridden and cognitively only functional in and out. Like it was very touch and go because technically by the time I realized that it was the concussion causing the issue and that like Dr. Tennant had said in that video that this is technically a, a diagnosis of early onset dementia in terms of when the microglial cells attack the white and gray matter in the brain, that it renders the patient as, you know, going through early onset dementia. I had forgotten what Waffle House was for about 2 weeks. I tried to place it in my mind, couldn't. I supposedly, allegedly, had told my parents that I did not know how to make popcorn anymore. Don't remember ever saying that. There are months missing, but those months that are missing are also due to ketamine withdrawal, because I was getting off of topical ketamine and there are just chunks missing. So that's basically the degree to which I was cognitively declined. Could not necessarily hold a conversation many days. Definitely couldn't sit here under a fan that's on because of how freezing cold everything was. I was kind of curled up in a fetal position, dependent very much on electric blanket, um, very, very, very severe pain, intractable daily. It was miserable. It was like level 11 out of 10 pain, which I know you understand. It was terrible. So the first three things I'm going to mention are kind of what like unfroze my central nervous system from that state and had me be able to function. The next three things are things that I have added in the last 1 year that have made such an insanely large difference that I'm able to, like I mentioned, like hold down my full time business on my own, do everything, manage things myself, and I haven't hit burnout, um, to the point of where before when I was kind of bedridden, I would go out and do a couple social events, go out and try to work out, go out like a couple of things for maybe 2 weeks, and then I would just like have to be in bed for 6 months because I would injure myself or I would push myself too far. My nervous system would just kind of like shut down again. So it's these are all I'm just trying to paint a picture of the difference in my life that's been possible because of all these things. So, without further ado, let me talk about the hormones briefly and just do a brief overview of everything. Now, again, this is okay. Let me one more disclaimer, real quick, guys. Thanks for your patience and listening to me as I take this at the pace I need to take it. So, um, I am an admin of the group here. Um, I kind of was, jumped in and collaborated with Michelle when she was um, an admin here. And so I, we have met in person, talked in person, and I've been I'm a huge rule follower. Okay. So I've been kind of taught, the process of this is how she was doing it. This is how the things I should do. I'm very strict myself on not promoting. There's a ton of supplements that I have taken that are from my own company, right? That help me a ton. If I ever mention, hey, this supplement helps me or whatever, I mention the type of supplement, not where I get it from, because I'm very again a rule follower. And one of our group rules is not to promote things that would benefit us, right? So I want to specify, clarify, in case it sounds unclear for any of the details I mentioned here. Absolutely none of the things that I have done or that I promote, like I gain any financial benefit from, whatsoever. So I've gone out of my way to make sure, even for one of the items that I recently started, that my friend set up the account, the links, the everything for you guys so that it goes to her and not to me. And I don't do anything in terms of trying to make it have any benefit from that modality, anyways, because it's a conflict of interest for me. So I just want you to understand that if you see, you know, links or if I connect things, this is not me promoting myself or benefiting at all from sharing any of the things in terms of personally or financially benefiting. I benefit because you guys possibly have things to look into, get help from, and like I've helped many people start many of these modalities before, and those who stick with them have received insanely large benefit, honestly. Those who do not stick with them I can't lie, like just don't have continued benefit, just as anything in life. But specifically with frequency specific microcurrent, it is the kind of treatment that you have to keep treating in, and when your body is at the point of receiving all the benefit it can, you can continue treating on like a tune-up basis, but you have to kind of push through some really, really deep, potentially pain that it resurrects and then resolves. And that takes a lot of fortitude and it's difficult. And so there are people who've tried it who haven't stuck with it, or they said it made them worse, but they did like not 18 months of treatments. So, or plus. So I just give that as a slight disclaimer. Okay, so all that being said, the hormone protocol that Dr. Tennant talked about and kind of figured out for this Ehlers-Danlos syndrome patient, 4-year-old, back, I want to say at least 10, 12 years ago now, is a combination of using oxytocin and HCG. Now, today, Dr. Tennant will tell you to skip HCG and to use something else alternative. That information specifically is in this group on Facebook. I've got to find exactly what that group is called, so bear with me as I find that. But it's something I've linked. I have linked that group here for us. So I'm going to find that as I am speaking here. So the oxytocin is a pregnancy hormone. I'm sorry. If you know oxytocin, you know it's not a pregnancy hormone. It is a hormone that is produced in massive quantity when you're breastfeeding, when you go to give birth, when you give someone a hug for 9 seconds, when you pet a dog. It's called the love hormone, and it's extremely beneficial for depression. It's extremely beneficial for anything related to pain because it's 10 times stronger than morphine. So it's a hormone and it's already produced in the brain of both males and females. Therefore, it's not, in my opinion, it's more natural and safe than trying morphine or something stronger like that. Pardon me, guys. I'm still not really the best at talking and keeping, that's what it's called, doc talks. Okay, I'm not the best at looking for information or writing information down while either talking or receiving information. So Doc Talks. Join this group on Facebook, DOCTOKS, Doc Talks. And this is someone I believe I haven't even had a personal conversation with Jamie, but I found that she must have invited me. I don't know if through central pain syndrome she found me, but I got invited to one of these earlier Zoom meetings that she was doing on a weekly basis, basically to interview Dr. Forrest Tennant and another doctor. And so I think it was like the 10th one, or it was one of the early ones that I was on, and I was asking the question to Dr. Tennant about ever needing to stop HCG for pregnancy, and he was explaining how HCG is not, like if someone's brand new starting and looking into the hormone protocol right now, HCG is not what he suggests they get on. He suggests some alternative. So I apologize that I don't know exactly the alternative, but if you go through Doc Talks and their YouTube channel specifically and go back, I think it's episode 10 that I'm on, somewhere around the 25-minute mark, and you can find his answer to that. So there's some other hormone. I use Pregnol, which is the longest story made short. HCG, human chorionic gonadotropin, is no longer considered a biologic. It was reclassified by the FDA in 2020. So because of that, the price went up tremendously, and it only became available through pharmacies that would compound it. And all the pharmacies that would compound it were literally lying, saying that they had some licensure $20,000 licensure in order to compound it, and they didn't. So pharmacy after pharmacy after pharmacy was literally like a sinking ship trying to sell all the remaining HCG that they had, lying to everyone, especially and including in Power Pharmacy. This might be information that I need to actually cut out of the live in order to put this on YouTube, because I don't know if legally I'm at the liberty to share any of this, since it's not technically my information. But I'm just telling you, as a patient, I was trying to get my hands on HCG, and I was getting feedback that Pregnal's the same thing, there's no difference, blah blah blah. But as you may know, being a patient, sometimes you're told, oh, it's the same thing, there's no difference, you're fine, and it's not the same thing, there is a difference, and you're not fine. So I was very nervous, because this is the main thing my spinal function is dependent upon. For, the other thing that happened was I had a water skiing accident. It did not result in. I've never been to the hospital for broken anything other than my arm and my foot as a kid and before the brain injury. So this was not like a major spinal cord injury, but it was something that bruised something, that jostled something and affected everything. So all that to say that the Pregnal and the HCG has become what I'm pretty much completely, my life completely, like my functionality totally depends on this. And that has been a result of me using this for 7 years now, and following the protocol to a T. Again, though, Dr. Forrest Tennant currently recommends something alternative to this, because this is very hard to get on, in terms of hard to find the script, a doctor who will prescribe it for pain. And it's not as hard now as it was 7 years ago. It was absolutely insanely difficult then. But now it's really expensive. This is like a $200 to $400 a month vial. So, and it's non-insurance compliant. Like, insurance doesn't pay for hormones ever. It's a whole long thing. So that's HCG. So HCG, look into the alternative that Dr. Forrest Tennant recommends, on Doc Talks. There's a ton of other videos on Doc Talks that I'm sure have other valuable information. I've not been keeping up with watching them, just personally. Um, Again, I'm talking about the things that are helping me. I haven't been looking into that recently. So Oxytocin, what I used to do, I know a lot of people are going to ask this question. So the nasal spray, the, troches, the sublingual, what do we do? So I used to use the troches and had every kind of benefit from them. Then I switched to the nasal spray because it was cheaper at a time when I needed to pay less. That was, I would say, just as effective. You cannot buy the nasal spray on Amazon, on some website somewhere, and expect that it's the same as sterile compounding pharmacy's formulation. So definitely try to get a script for that, and try to take it to a pharmacy and get, the nasal spray is probably the cheapest option, I think. But it was around 90 or 100 a month for how many units I was using, because I was, at the time, to my memory, using like around 60 units a day. So I think I would spray 3 sprays that were 20 units each. That was around $90 a month, maybe 80, maybe 100. I have found a pharmacy, a sterile compounding pharmacy, who will work with me on the pricing, because I get this script, I get the Pregnal, and I get a consistent, like, I'm very interested in being loyal to a good pharmacy who will give me good deals and get all the medicine I can get from them, because I don't want to have multiple pharmacies, pardon me, if I don't need to have. So she has really worked with me, and she has given me now what I was explaining to her that Dr. Forrest Tennant suggested anywhere between the 20 unit troches at the time, once a day, all the way up to 8 times a day. So math with me for a second because I'm really bad at this. 20, 40, 60, 80, 100, and 20, 40, 60. So 160 units a day. So anywhere between 20 and 160 units a day is kind of the range what he was suggesting. So what I got my pharmacist to work out for me is she now creates for me the the sublingual tablets, which go under the tongue, 50 unit tablets, and I take between 1 and 3. Well, really, I consistently take 2, so that's 100 units, where I was only taking 60 before. Now I take 100 consistently, and some days I take 150 units because I take 3 of them. So it works for me to have that range of difference, and she charges me $100 a month for this. So it's the same price for a month's supply of basically double, at least a 40% improvement in terms of dosing. So that's really worked out for me. This is what my pain reduction is drastically dependent upon these days. On a side note, other than medicine related, turmeric recently, adding turmeric has been the other massive and instantaneous pain reduction. I formerly was allergic to turmeric and I stayed away from it. And then I realized my body just needed to adjust to it. I needed to do it in a better fashion. So I did a slow adjustment period, went through some tummy troubles briefly, got, past it, and wow, what a difference it makes. I could take that pretty much all day, and I take a lot of it, and it does help because a lot of what we're dealing with central pain syndrome um, is either neuroinflammation or microglial cell inflammation. I might not be quoting that exactly. Pardon me again, I'm not a doctor. But we're dealing with lots of inflammation, particularly myself, and the tests I've had run, the way my markers show is that I still have a great deal. So, on the topic of inflammation, and the other main thing that has made a huge difference, the most information you can find about this and my experience is in this as in FSM is in this Facebook group, Central Pain Syndrome. Go to the files section and look for Kelsey FSM story. I believe it says 2018 or 2019, probably 2019. So I started using frequency specific microcurrent in 2018. Sorry, I'm trying to find where the camera's at. Okay, so this is the custom care unit. This is a unit that I purchased directly from my doctor at the time, who I mentioned once before. He since had a heart attack, unfortunately passed away. But there is a doctor in Jacksonville, Florida, that I can put, again, like I'm going to put links in the comments here. And I might do that now. So this is Dr. Grable, and I believe this is still his website. So Dr. Grable in Jacksonville, Florida, he has expressed to me specifically that he would happily treat anyone else with central pain syndrome, and prescribe for them the Pregnol if needed, the Oxytocin if desired or needed, and he would treat them with the FSM care unit. He sells the machine for, I believe, unless it's gone up, somewhere in the $3,500 range. It's a one-time purchase unit, but you can go and try it just about wherever you live in the United States and many other countries. You should be able to travel to a practitioner somewhere near you if you go to, again, I'm going to type in some links in the comments here. So frequencyspecific.com. And that is where you will see find a practitioner, and you should be able to find, this is Dr. Carol McMenken's website, frequencyspecific.com. That should work. I just am going to make sure. I sent it, I put the link in correctly. So this has been, in all honesty, like the combination of using frequency specific and probably especially Pregnal has honestly, this is what unfroze my central nervous system. This is what kind of gave me initial, like, massive amounts of healing. I think has been responsible for at least a half healing experience. Yes, that is the correct website. You're going to go to where it says practitioner. Sorry, what you're looking for is, I haven't been to this one. Oh, it's bright yellow on the top. Find a practitioner. I think the website's been updated a little bit, so it looks good. So find a practitioner. You're going to click on that on the frequency specific website. If you want to try FSM, it's usually most practitioners and chiropractors and acupuncturists will be on the list for treating. They'll have like $1 a minute. At the very least, give yourself one try of the inflammation treatment and see if it makes any difference for you. Because all of us with central pain, regardless of the cause, all of us are dealing with inflammation of the thalamus, right? And inflammation somewhere in our body that either got stuck, is unresolved. That's what pain is like most coupled with, is like there. I cannot imagine a case with central pain syndrome in which we are not experiencing any inflammation. So if you do nothing else other than try the frequency that is inflammation whole body, 40, channel A is 40, channel B is 0.1 in my memory. Might be opposite channel A and channel B, but that frequency has changed my life. I had the Dr. Grable, create an 8-hour-long protocol of that frequency and input it onto my machine so that I could run it overnight. And I now attach this to, I'm going to talk about in a second, my grounding mat. I have done a ton of research and questions to FSM practitioners and grounding people all over. All of them told me that it would not work to connect my FSM machine, to the grounding mat. I tried it anyways, and it did work. By the way, this is my puppy. Good boy. And he's such a love. Yes, good boy. Also, he's my service dog. My good boy. Hi. So, he's also a bit sleepy. Okay, so FSM, try inflammation. For myself, the concussion protocol has also made a huge difference. The central pain protocol. There's so much information to go over. Sorry, guys. It's going to be as long of a live as it takes. But I appreciate you sticking with me, and I hope this information is helpful to you. So, what a good boy. The central pain frequency is a frequency, to my knowledge, so there's like thalamic pain, right? Okay, we've had a stroke, for example, a thalamic stroke. The thalamus in the brain is undergoing inflammation. It's midbrain inflammation. I don't have the printed and laminated sheets, but I have pictures of them because I have seen the lists of frequencies that this machine capacitates for, and there are ailments out the wazoo that this machine can treat. That's pretty much. I'm not a practitioner. I may become one someday because of what I've seen this machine how I've seen this machine make a difference. I am allowed as a patient to treat family and friends for free. So I have watched my cousin with fibromyalgia receive massive benefit. He also was using the machine daily like myself, found a way to run it dry, which I'll talk about, or you can find information on the in that file I talked about. Because the best, most effective way to run this machine is attaching it to like wet towels and put that around your neck and feet if you want to treat your whole body. So we found ways to like run it dry and attach it to our clothing and wear it in a fanny pack and have wires everywhere, but like, manage things. And that's how I've done the most of my treatments as I've been up and on the go. But for the first 90 days, I kid you not, I just ran this central pain frequency over and over and over and over and over and over again. And that in tandem with the hormones like flooding my system as a result of the reduction of pain was the first thing that gave me waves upon waves upon waves upon waves upon waves of pain relief. And it was, I just remember because it was 2018 around August that I just felt like awestruck and genuinely surprised that pain relief could hit me and just keep hitting me. Like it was just crazy. It was like this lift. It was amazing. So, if I in years past, especially the last few years, have really sounded like a broken record, you guys, those who've been in this group for a longer time, specifically about these two main things that have helped me, it is because it's like someone who has been healed of blindness and says like I was blind and now I see. It was like I was stuck and now I'm unstuck. That was my experience with these modalities. So massive, mega, ultra, huge, incredible difference they've made. Any questions, please feel free to reach out. But again, I will get to anyone's questions just as soon as I can. I don't mean don't ask me questions. I just mean be patient with me because I also run a full-time business by myself. So that's FSM. I don't know what else to mention about it that's relevant, other than Dr. Grable again has said that he will treat. He has the central pain frequency that my other doctor created. I believe that there are other central pain frequencies that Dr. McMankin uses and has created, and other practitioners have. All the practitioners should have access to a thalamic pain frequency, which is 40, which is inflammation, and 89, which is midbrain. 40 and 89. And as long as they have that, they should be able to help treat central pain. For some reason, I think I broke down at some point. I wrote down in my phone literally every single frequency, the number of minutes it ran, and so that I could recreate that or have the doctor recreate that. And we determined that there are some differences in the central pain frequency my other doctor created. Again, it's been a minute since I've been so technically delved into all of that I can't recall it like fresh. Right now I'm in dog training world and I'm in Ren Kelsey's life world. So pardon me for not being perfectly on point about all of those specific details. Though in the past, I have done my own doctorate level education on just like discovering what this is and how and why, and talked specifically with Dr. McMankin myself, and she's wonderful. And so she helped me discover that I needed to get the glasses because I had a glitch of, I guess technically it's called convergence insufficiency, where my one eye was straining to meet the other eye. So I didn't know that was a result of my brain injury. But guys, if you can get checked out by someone who knows what they're talking about when it comes to, like, if you just, I guess my whole side comment spiel about that is, if you have some kind of pain that doesn't make sense as a symptom and it's nagging you and you're downplaying it or you wonder what it's about. I've had in the last 16 years, I'm not even actively able to bring to my mind a symptom that I have not experienced. I know I have not had symptoms that relate to like IBS. I have not had symptoms like complete and total paralysis for long periods of time. Like there are some extreme things that I know I've not had. Um, but I mean, I've just, especially in the earlier days with my CPS, my body was just going through so many changes. It was adjusting. All systems were on high alert. Everything was being affected. I would experience this weird symptom one day and not the next day and never again. And other things would last for weeks. It was just so weird. So, one thing that remained constant was like pain in this eye, pain related to the inner ear. I thought it was related to wisdom teeth surgery. Later determined, especially through Dr. McMankin doing that finger test, that it was brain injury related and actually a separate diagnosis that prism lens glasses could at least put a band-aid on for now until I can do therapy. I can't do therapy for it until I fix my fight or flight even more. So, yay, fun. Um, okay, the next thing. So I've gone over the hormones. I've gone over the frequency specific. So those of you who maybe watched the live that I did a number of years ago might now be up to date on information that I shared before. Okay, since all of that, I have discovered